So let's quickly talk about the disadvantages of fine needle biopsy, also known as what FNAB. All right. So disadvantages of this fine needle biopsy. So let me just give an overview of what a fine needle biopsy is. A fine needle biopsy is simply you trying to what? Inject a needle to an area where you know that there's cancer in the breast. Okay. So you inject it and you aspirate the tissues so that you can take it to the laboratory, do some testing to establish if there's what? Cancer or not. Okay. So this fine needle biopsy actually has somewhat disadvantages. Okay. And these disadvantages are what we're going to look at. Okay. So fine needle biopsies has several disadvantages, like it could show what? False negative results. Okay. So false negative results, you say that what? This may miss cancer cells, all right, leading to a false sense of what? Security. Okay. And false positives now, this one may misidentify benign cells as cancerous. Okay. That may misidentify benign cells as what? Cancerous. Okay. Then inclusive results. Inclusive result is when you are having insufficient cells or unclear findings that may require what? Repeated procedures. And when you are repeating the procedures, now remember that this procedure is invasive. You are causing more pain to the patient. Okay. Then limited sampling. This is only a small sample is collected, which may not represent the entire tumor. Okay. Then no tissue architecture. The fine needle aspiration biopsy only collects individual cells, not the tissue. Okay, because it's just going through the needle, so it's just something small. All right, so it collects only individual cells, not tissues, and this makes it difficult to access the tumor structure. Okay, and then also difficult. Okay, see, this one is just like an overview of what you should expect during fine needle aspiration biopsy. The doctor will locate the lumps by feeling or by ultrasonography. Then a fine gauge needle is used to extract fluid. Okay, so the fluid is just cells, not tissues. All right. So on that basis, you'll not be able to what? Access the tumor structure. Okay. And moving forward, we say that there's usually difficulty with small lesions. So fine needle aspiration may struggle to accurately what? Sample small lesions. Operator dependence. Skill and experience of the operator can impact the results. Okay. Pain and discomfort. Some patients may experience pain or discomfort during or after the procedure. Okay. Then bleeding and bruising. We say that risk of bleeding or bruising is at the biopsy site. Okay. The limited diagnosis, fine needle aspiration biopsy primarily will diagnose cancer or non-cancer, but may not provide detailed information on the tumor type or level of the cancer, or you could say grade of the cancer. Okay. Then no genetic testing. Fine needle aspiration biopsy samples are often insufficient for genetic testing, which may be necessary for personalized treatment. Okay. The follow-up biopsy. Sometimes it is necessary to confirm results or obtain more tissue for further testing. Okay. So despite these disadvantages, fine needle aspiration biopsy remains a valuable diagnostic tool, especially for what? Initial assessment and guiding further testing and treatment of what? Breast cancer. All right. So these are what the disadvantages of fine needle aspiration biopsy. See you guys pretty soon.